Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower left third molar and is its association with the inferior alveolar nerve. Now the lower left third molar is grossly carious. We can see that the caries is distally located. The tooth is erupted, but the roots and are very closely associated with the ramus and the retromolar region. Now this is the panoramic view. On the panoramic view, we can clearly see that the lower left side, this is the inferior alveolar nerve, the highlighted in orange, and we can see that the apex of the roots is closely associated with it. Now we're going to show you the transaxial view. The transaxial view is basically the view that gives us a proximal idea of the tooth. Now on the transaxial, this is the transaxial view. I will zoom in for our kind doctor. There we go. So this is the lower left hand side. This is the lingual region. This is the buccal region. The orange highlighted here is the inferior alveolar nerve. Now we're going to move distally. This is the mesial cusp of the wisdom tooth. The mesial root is slightly far away, but this is the interradicular area. But as we are moving distally, here we can clearly see that the distal root apex is very close to the inferior alveolar nerve. Now, the more interesting part here that our doctors can understand, I've removed the highlighting. This is the inferior alveolar nerve canal. We're going to zoom in slightly more. There we go. Now on this, I need you to understand that this is the root of the distal aspect. This is the distal root. There we go. Right. There we go. And this is the distal root. The apex of the distal root is touching the cortical plate of the inferior alveolar nerve right here. We do not see any compression. That means that the tooth is not compressing the nerve. However, any apical movement of the tooth during the extraction can result in damage to the inferior alveolar nerve. The inferior alveolar cortical plate is completely intact. We don't see any bean shape or any compression. And throughout, and this is the mesial aspect, we can see that the tooth, the canal morphology does not change very significantly. This is the mesial root. On the mesial root, we can see that the tooth is slightly away from the inferior alveolar nerve. We do not see any major periapical radiolucencies, so there's no infection spreading into the bone so far. Pedial widening is not very significant, so that is something that the doctor has to be mindful of. The lingual cortical plate is extremely thin in the lower left region, so that's another thing that our kind doctor needs to be mindful of. On the axial view, this is the axial view. This is the tooth. This is the grossly carious nature of the tooth. This is the left hand side. As we are moving inferiorly towards the apex, we can see that the tooth is embedded into the bone. We've got good cortical plate on the buccal side, but very minimal cortical support on the lingual aspect. We also see that there is a radix intermoralis right here, a third supplemental root associated with the distal root right here. So this is another very important finding that we have seen on this 3D CBCT, that there is a third supplemental root right there. So this is something that our doctor needs to be mindful of. On the axial view, we can see this is the inferior alveolar nerve. It is very buccal to the wisdom tooth, but it is very closely associated. There's absolutely no distance or bone present between the roots of the lower left wisdom and the inferior alveolar nerve. So this is the CBCT. If you have any further questions regarding this case, please feel free to reach to our team. We will be extremely happy to help. Just to give you a slight idea on a coronal view as well. So this is the coronal view. We're just going to move in. This is the second molar, and this is the third molar on the left hand side, and we can clearly see that the root is very closely associated with the inferior alveolar nerve. This is that supplemental root portion on the lingual aspect as well. Thank you very much.